BSMMU সিনিয়র স্টাফ নার্স রিক্রুটমেন্ট এক্সাম 2013 সালের বঙ্গবন্ধু শেখ মুজিব মেডিকেল বিশ্ববিদ্যালয়ের সিনিয়র স্টাফ নার্স পদে চাকরি পরীক্ষার প্রশ্নের সম্পূর্ণ সমাধান 1 থেকে 100 পর্যন্ত। During active management of third stage of labor, how will you give oxytocin to ample IM state? Which of the following point is included in normal vaginal delivery? Presentation will be cephalic. What is the normal fetal heart rate? 110 থেকে 160 beat per minute. How will you calculate expected date of delivery? 9 months এবং 9 মাস 7 দিন from LMP. Immediately after delivery of a healthy baby, which is the first step to do? Dry the baby. Before starting intravenous antibiotic, what will you do? Skin test to see hypersensitivity. How many numbers of cranial nerve present in our body? 12 pairs. Bedside test for urinary protein examination. Heat coagulation test. Flowing vaccine are given in EPI except mumps. Normal level of serum creatinine is 0.4 থেকে 1.2 mg per del. Which part of upper limb is to be washed before nursing a patient? Up to wrist joint. Nurse is collect blood for CS from which side? Vein. How will you clean the external genitalia to collect midstream urine sample for urine CS? By soap and plain water. You are asked to infuse 240 ml 5% dextrose in 0.2 to 5% sodium chloride within 24 hours. How will you adjust the drop in microdrop per minute? 10 microdrop per minute. You are asked to provide tepid sponging to a child with hyperpyrexia. Which is the best? By slight warm water. Number puncture is to be done in a 12 years old baby. Which is the ideal size of cannula? 25 G. You are on duty in NICU. A baby developed respiratory distress with 40 discharge. What will be your first action? Oral and nasopharyngeal suction. The best side of an intramuscular injection is outer upper quadrant of the buttock. Risk factor for deep vein thrombosis. Oral contraceptive pill. Complication of urinary catheter is urinary tract infection. Condition in which tube feeding is mandatory, Condition in which tube feeding is mandatory, What suction is necessary in a container for sending tissue for biopsy? Formalin 10%. Diazepam injection is given to infant for control for convulsion. Per rectal. What is the first management of a neonate found to be apnoeic? Tactile stimulation. Normal flow rate of infusion is microburette 60 drop per ml, mycoborate 60 drop per ml, 5% D-saline 1000 ml given at the rate of 15 drops per minute. Total time required for infusion is 60 hours. Color of IV cannula indicate flow rate and internal diameter. Which one is first organized nursing school established by Florence Nightingale? St. Thomas Hospital in London. Nursing code of ethics is defined as principle by which nurse provide care to their patient. The founder of modern nursing is Florence Nightingale. First duty of nurse in post-operative room to ensure position of the patient. What is the ideal recovery position of patient after oral surgery? Lateral position with slight head up. About chest drain management, drain tube must be under 2 cm of water. About oral suction, it is essential for unconscious patient. About medical hand wash, before and after all patient contact. About blood pressure measurement, systolic pressure measured by palpation. Intravenous injection of drug is given by only trained registered nurse. About body temperature, which is true? Variation is 1 degree Fahrenheit from morning to evening. Barrier nursing is the use of infection control practice. Protective isolation is an essential for treatment of burn patient. AIDS mean acquired immunodeficiency syndrome. HIV has isolated from blood. For continuous irrigation of urinary bladder, which fluid is better? 0.9% sodium chloride. The most effective position for the patient with cardiopulmonary disease. 45 degree semi-flower position or 45 degree semi-flower position. The priority when providing oral hygiene to an unconscious patient, prevent aspiration. Which of the following right has been added to the traditional 5 right of medication administration? Right documentation. 60 kg weight female patient needs 300 ml fluid per day. What is the flow rate is standard? 30 drops per minute. For the treatment of anaphylactic reaction, first choice of drug is adrenaline. For destruction of spore-bearing organism, which method is effective? Autoclave. Infectious disease such as hepatitis B and C become a reservoir for pathogen in blood. When nurse is performing surgical hand hygiene, he must keep hands above elbow. Which one is isotonic saline? 0.9% sodium chloride. Which drug is used in nebulization? Salbutamol. Which gland secretes thyroxine? Thyroid gland. What is the common complication of necrotic drug when given intravenously respiratory depression. Which drug need skin test before administration? Benzyl penicillin. Absolute bed rest with oxygen therapy is essential for the treatment of acute left ventricular failure. Which IV fluid you will infuse to a patient with severe dehydration due to sweating? Normal saline. Which one is the prime duty of a nurse for caring of a child suffering of AGN? To maintain intake-output chart. Which one is intrauterine contraceptive device? CUT. Just after delivery, what should be given to the baby? Mother's milk. Flowing infection can be prevented by vaccination except hepatitis C virus. Which preparation is given in subcutaneous route? Insulin. Which is the part of large intestine? Cecum. Longest bone of the body? Femur. Clinical manifestation of organophosphorus poisoning are all except constipation. If a patient came with an incomplete abortion with bleeding, what will be your first duty? Call the doctor and start IV channel simultaneously. What criteria indicate first stage of labor? From labor pain up to full dilatation of cervix. Which of the following include universal precaution? Use of soap, water only. About mannitol, which one is correct? Give within 20 to 30 minutes for reducing ICP, intracranial pressure. Which area of the body more prone to bad sore? Sacrum. Common complication of IV infusion? Pyrogenic reaction. When Bangabandhu Sheikh Mujib Medical University was established? 30 April 1998. Who was the first vice chancellor of the Bangabandhu Sheikh Mujib Medical University? Professor M.A. Kadri. Similar meaning of the sentence except C. C said there was an outbreak of cholera in the town. মানবত্বকে কোন ধরনের রঞ্জক পদার্থ থাকে? মেলানিন। কোন ভিটামিন পানিতে দ্রবণীয়? ভিটামিন সি এবং বি। সঠিক উত্তর সি। এইচআইভি ভাইরাস দেহের কি ক্ষতি সাধন করে? রোগ প্রতিরোধ কোষকে আক্রমণ করে। মায়ের শাল দুধের মূল উপাদান কি? ইমিউনোগ্লোবিউলিন। সমাধান করুন। -এ প্লাস, এখানে 0, 10 20, উত্তর হবে ডি, অর্থাৎ 20। 1971 সালের এপ্রিল মাসে কোন তারিখে প্রবাসী বাংলাদেশ সরকার গঠিত হয়? 17 এপ্রিল। 1971 সালে 25 মার্চ রাতে পাকিস্তানি হানাদারদের ঘৃণ্যতম অপারেশনের নাম কি? অপারেশন সার্চলাইট। বিজয়ের দিনে পাক হানাদারদের আত্মসমর্পণ অনুষ্ঠানে বাংলাদেশের সরকারের পক্ষে প্রতিনিধিত্ব করেন ক্যাপ্টেন একে খন্দকার। বেতার যন্ত্রের প্রথম আবিষ্কারক কে? মার্কনি। মুজিবনগর সরকারের প্রধানমন্ত্রী ছিলেন তাজউদ্দিন আহমেদ। আমি রোগীকে চিকিৎসা দিতে থাকিব এর সঠিক ইংরেজি অনুবাদ হলো I shall be treating the patient. The love of mother is never exhausted. মাতৃ স্নেহ কখনোই নিঃশেষিত হয় না। ডায়মন্ড কাটস ডায়মন্ড, মানিককে মানিক চিনে। Flowing infection can be transferred through transfusion. Hepatitis C virus, hepatitis C virus. Flowing are antibiotic except furosemide, furosemide. Most common organism of diarrhea in children, rotavirus, rotavirus. Stridor or abnormal breathing sound is found in a post-operative patient in foreign body in the upper airway tract, foreign body in the upper airway tract. Which organism may be transmitted from mother to fetus? Hepatitis A, B virus, HIV virus, HIV virus. Which organism may be transferred from mother to fetus? HIV virus. Normal serum potassium level 3.5 to 5 millimole per liter, 3.5 to 5 millimole per liter. মুক্তিযুদ্ধের সময় কয়টি সেক্টর ছিল? 11টি। সাব সেক্টর ছিল 64টি। কবর নাটকটির লেখককে? মনির চৌধুরী, মনির চৌধুরী। কবর নাটকটির লেখক মনির চৌধুরী। নার্সিং বিষয়ে যে কোনো জিজ্ঞাসা বা প্রশ্ন থাকলে ভিডিও নিচে কমেন্ট বক্সে কমেন্ট করে প্রশ্ন করুন। নার্সিং বিষয়ে প্রতিনিয়ত আপডেট পেতে প্লিজ সাবস্ক্রাইব আওয়ার ইউটিউব চ্যানেল বিডি নার্সিং ফর ইউ, নার্সিং ভর্তি প্রস্তুতি ও সহযোগিতা কেন্দ্র।